So there is a rising trend about egg freezing. So let me just share something about that. It's Fertility Friday. Before you think about egg freezing, you need to understand the process. You need to ask questions. You need to find out why you need it, when you need it. You need to also ask questions about the fertility experts and the fertility clinic. So I had a consultation with a young lady, a single lady at 45. We literally spent over 1 hour during the consultation. You can't imagine that we went back and forth discussing about her reproductive options because she wanted to freeze her eggs at 45. Now, it's really okay that you want to do that, but you have to ask yourself a couple of questions. And I was really happy that after about an hour of going back and forth with her, she made a very sound reproductive option by accepting IVF and egg donation. Don't get me wrong, egg freezing is wonderful. I mean, in modern fertility practice, the benefits of egg freezing for women, single ladies, divorced women, the benefits cannot be overemphasized. And whether you're a single lady or not, it's typically the same process for both single ladies or for women who are not single who would want to make good reproductive choices about freezing their eggs. But you need to really, really understand the process. And then you need to ask yourself and ask the experts a couple of questions. And like I said earlier, in modern fertility practice, the benefits of egg freezing can't be overemphasized. I mean, literally, women of this generation, they have their different priorities. Their priorities have completely changed. They are into their career. They want to do well. They want to achieve a lot. And that's very appreciable. Most women even do so much better than even their male counterparts. And at their peak in their career, in their 30s, they do not want any distraction. Apart from this, you would also agree with me that the majority of women, as they advance in age, they end up seeing their perfect match. So what do you want them to do? One of the great options for this group of women is to freeze their eggs. Not necessarily that those eggs would 100% be used. Now, when these women get to their late 30s, 40s, and they are even able to achieve pregnancy spontaneously and naturally, they obviously will not use those freeze eggs. But those eggs already, they are backup plans for very smart women. So when you look at all of these benefits, then you would really understand that it's really a good backup plan for women to freeze their best quality eggs until they're able to make sound reproductive choices and they're able to have their own babies. By so doing, they are beating time, having the best quality eggs, because I have always said it over and over again, that time is the greatest contender for women, especially when it has to do with our fertility. And I asked that woman a very simple question. Have you ever wondered why women, when they are in their 30s, they have less chances of having miscarriages compared to women in their 40s? I'm sure you've heard this over and over again, that by the time we are getting older, by the time we are aging, we begin to lose both the quality and quantity of our eggs. So this woman who was 45 years old, despite her reduced egg reserve, she really indeed wanted to have egg freezing. And I'm going to tell you what I actually told her. And I asked her a simple question. Have you ever wondered why women in their 30s, they have less chances of miscarriages? I mean, women who are 30 to 35 years of age, the chances of them having miscarriage is about 11 to 15%. Now, when you compare that to women who are in their 40s, like when you are above 40 or when you have clocked 40 and above, this exponentially rises from 11 to 15% to about 50%. That means that when you get to 40, you have 1 in 2 chance of having a miscarriage. Now, it's simply because of the quality and quantity of our eggs. They have depreciated. The machinery that helps to service the genes, those machineries have gotten old, they have gotten weak, and as such, we begin to have low quality eggs as we age. So nature has no choice than to find a way to take out those pregnancies, which are likely to have a lot of errors. And so miscarriages occur disproportionately high in women who are above 40s compared to women who are in their early 30s. It's just simple because of those inborn errors, because of the reduction in the quality of our eggs. And so when you get to your 40s, you get to your mid 40s and you say, doctor, I want to freeze my egg. Yes, you can freeze your egg. But you have to ask yourself a simple question. What are the chances that I would have a successful pregnancy even with that frozen eggs? The answer is the chances of having a successful pregnancy even with such frozen eggs are very, very low. You just have to compare that with somebody who is going to freeze a food that is getting close to expiry date or an unfresh food. And you expect when you unfreeze the food, the freshness will be there. Absolutely not, because the freshness of that food has never been there. So when you unfreeze, you're going to get something that is of poor quality. The same thing happens to you when you want to freeze your eggs when you have increased in age. At 37 years of age, there is a rapid decline in the quality and quantity of the egg. This increases so rapidly when you get to your 40s. And as you're increasing in your 40s, the quantity and quality of those eggs begins to depreciate so very fast. So you can freeze your eggs, but what's the chance that you can have a successful pregnancy after freezing those eggs? Another question you need to ask yourself is, how many years do you want to freeze these eggs? Now, this patient was 45 years of age, and let's say you want to freeze your eggs for the next 1 or 2 years. Don't forget that as you also increase in age, there is also higher chance of having pregnancy complications with increased age. So it's okay to freeze your eggs. It's a welcome development. It's a very good reproductive choice. However, you need to ask yourself a couple of questions, and you need to take the right decisions, and you need to make well-informed reproductive choices. I hope you've learned something today. Don't forget to like, share, comment. We continue with this topic during the next section. Tell me how you feel about this content, and don't forget to follow at Women's Health with Dr. Nonny for more health tips. Take care.